If I had to be one organ, this is the one that I would be. Hi everybody, welcome to another video. I'm so happy to see you guys back here on this channel. For those that know me, hello, welcome. For those that might be new to the channel, I'm so happy to have you here. My name is Dr. Elyse Tursi. I practice functional medicine here in New York. And today's topic is one that encompasses so much health in a small kind of organ. So many things are going on, and we're talking about liver health, why it's so important to have a good liver health. I know a lot of you guys are thinking, when I say the word liver, you're thinking alcohol, because I find that when I say that to my patients, the first thing that comes to their mind is, but I don't drink, or I hardly consume alcohol. And that is what we know about in terms of our liver. That's like a small, minute part of the detoxification pathway, but there's so many other jobs and functions of the liver that no one's really talking about, and all of those other jobs and functions do have a very significant role in terms of how you feel. And I want to really address that topic today, is what other functions am I perhaps not realizing that my liver is actually contributing to? So stay tuned. The function of our liver that is most known to us is detoxification, or getting rid of chemical compounds that are not necessarily the healthiest for us. That does include alcohol, but that also includes things like pharmaceuticals, herbicides, chemicals, food additives, environmental pollutants, biotoxins, mycotoxins, stealth infections, biofilms. All these things that we really don't necessarily think about are also involved in our detoxification pathways, and our liver does have to process and filter. So let's just use an example really quickly of this room. Here I am in my office, in one of the rooms in my office, and I would hope that they did a really great job cleaning, and they're cleaning the vents and really being diligent to make sure that there's no mold in the building. However, something that might not really be on my forefront of my mind is that perhaps there is mold in the vents. Perhaps there are spores that I'm not aware of. Who knows what is perhaps outside that maybe I'm breathing in when I'm in the office, when I open the windows. All of these compounds, we are basically bombarded by so much stuff everywhere, every day. And that could be environmentally, but that also can be critters that we don't really think about, like bacteria, mold, like I said, viruses, parasites, fungus. So what happens is that when our liver is working effectively, it should basically look at almost everything that comes into our body. So our liver is scanning the environment to say what's coming in through food, what's coming in through beverage, what am I taking orally through pharmaceuticals, what supplements, what enzymes am I taking. It's going to look at everything that comes in, and even things that we're breathing in from a respiratory perspective. And what the job of the liver does is it starts to say, are you toxic? Are you not toxic? Do we need you? Do we get rid of you? And there are some specific enzymes that are known to the liver that are involved in this process, namely cytochrome P450 enzymes, as well as, of course, our liver enzymes, our ALT and our AST. I want to just take a second here to talk about what is the job of the liver when it comes to detox. And really the job of the liver is to basically make things conjugated or more soluble, more user-friendly for the body to either excrete or to store. So things might come into our body, they could potentially be very toxic, and the liver will say, let's make this more user-friendly for your body, or this should not be in your body at all. We need to excrete this out. Let's put this in the stool. Let's put this, mixed with some bile salts and get this out of the body. So detoxification is one of the pathways where a lot of the stuff that we're exposed to is being looked at by the liver. Something that's not really addressed, though, that I want to share with you guys is if you are dealing with any type of viral load, if you're dealing with anything, Epstein-Barr, CMV, C19, I'll call it C19 still, if you've been exposed to different types of respiratory toxins, mycotoxins, that stuff can be inside of our liver hiding out. And what happens over time is the liver tries to keep up, but the burden can become so excessive that it cannot keep up with the load. And whenever we're talking about healing, we really have to take a non-linear approach. And what I mean by that is that a lot of patients that I work with, they by default, and I get why, but they have this kind of thought process that A plus B equals C. So if this, then this equals that. And unfortunately, that's not the case. So an example of this is hormone imbalance. Okay, let's talk about that. So we're talking about liver, we're talking about detox. Let's talk about the other job of the liver. This will make a little bit more sense as we continue, which is hormone balance. So a lot of times women say, I think my hormones are not balanced. I think that my estrogen's not in a good place. I think my progesterone might be too low. Maybe I'm too high on the estrogen platform. Maybe I'm having too many androgens. I have too much testosterone in my body. Whatever might be going on with the hormonal system. So we think, oh, the problem is my hormones. I must go to my ovaries and go to the organ that secretes the hormones. No, that is a very simple kind of way to think about health. What we'd have to do is say, wait a second, who else is involved in the process of hormone metabolism? That is the liver. Now, your liver actually produces cholesterol. There's two places that we produce most of our cholesterol. About 1.5 liters of it does come from our liver, and then other cholesterol molecules are synthesized in our bacteria from our gut. Well, what ends up happening is that if we have poor liver health, oftentimes from many things, which we'll discuss, that will create an underlying hormonal imbalance. So you guys are probably seeing that, oh, I might have a hormone imbalance that I thought was coming from problems with my ovaries, but perhaps there's other organs that are connected. And this is why taking a functional medicine approach works wonderful, because we cannot isolate you. I cannot just piecemeal you apart into these small things. I have to look at everything collectively. So when we're talking about painful periods, when we're talking about excess hormones, high levels of estrogen in the body, high levels of androgens, all of these things have a crux to them. And that is going to be, let's look at your liver health. Let's make sure that you're processing appropriately. Let's make sure that we're filtering out as we should be. Let's make sure we're conjugating appropriately, which the conjugation process is where we make really, really harmful things less harmful by the body. Okay, so detoxification, yes, that's the liver, that's the alcohol, but that's also every other thing that you take. Now, I want to take a moment for a second to talk about weight and pharmaceutical usage, because a lot of people that I work with are interested to lose weight. They're coming in, they're saying, I feel like I'm stuck. I feel like I'm stagnant. I cannot lose weight. What is going on? And we have there, again, a very linear approach to think it's what I'm eating. What I'm eating is the only factor that's affecting my weight, right? No. Food is one of the baskets that is going to be affecting your body weight. Now, for people that have kind of dealt with this, where they've done nutritional changes, they've done nutritional strategies, they've worked with people, they do understand this often. There's women that come in that say, I've done everything with my food and the weight still won't come off. Why? Because there's so much more going on inside of your body that is not connected to your nutrition, but is actually connected to inflammatory processes kind of underlying that are keeping the body in a place of it cannot lose weight. So the liver is involved with weight loss. Think of it like that. The liver is directly involved with weight loss because by default, it's dealing with the inflammatory cascade. It's trying to process things and get things out of the body. And if it can't do that job effectively, we won't be able to tap into that metabolic weight loss. Okay, so we want to make sure that when we're thinking about health, we're really looking at all the things, detox, we're looking at pharmaceuticals, something that's not talked about when we start pharmaceuticals, and we need them. I'm not knocking them. We need them. They have saved so many people's lives, pharmaceuticals, and they keep us healthy in some regards, but in other ways we don't need them. And in fact, they're creating more damage than good. And in those instances, for people that are perhaps over abusing or using things for too long of a time frame, you'd want to consult with your doctor around that. But in those instances, it will put toxic load on the liver, because your liver is looking at the pharmaceutical as well. And so overuse of pharmaceuticals, even over-the-counter types of drugs can cause stagnation in the liver and be another barrier to weight loss, which then all other problems start to arise, because when we have body weight gain, we actually don't feel well. We're living in a place of an inflammatory cascade. We have a fire burning in our body. So just be mindful that when you're thinking about weight, we talk about liver. When we think about how do I support my body if I've been exposed to an environment where there's mold. A lot of women share with me that perhaps their home or their office environment had toxic mold, and they've figured it out through their journey, through their pathways. And they're like, but what do I do? Like, how do I get this out of my body? Of course, we're going to go to the liver because that's processing environmental things, that's processing all other critters as well. So just as a little recap, I know we're talking about a lot, as we always do. We said detox of all things. We talked a little bit about hormone balance, liver related. We're talking about weight loss, liver related. Let's talk about skin. So your skin is really a function of what's going on internally. Your digestive system is part of your ability to get rid of things that shouldn't be in us. So a lot of times we can actually have an increase of what's called lipopolysaccharides, and our skin can be affected by all types of things. Our skin can have different types of rashes. If you guys saw my video on perioral dermatitis, it is a very relentless form of a skin irritation. There is an underlying hormonal balance, which means there's an underlying liver balance. Okay, there's a lot of things happening, but anything that's manifesting through our skin, it's because it's not being filtered or conjugated, usually in the liver. So if it comes out in our skin, that is one of the largest integumentary organs. Our skin is the largest organ, and it does connect with the outside surface. Anything gut related, we have to look at skin. Anything skin related, we have to look at gut. There is a bi-directional arrow there and a two-way street when we talk about these things. So if you're dealing with anything, even autoimmune conditions that cause rashes like rosacea or psoriatic arthritis that can even create psoriasis patches, all of these things have a connection to your immune system. Now, this is another factor that is connected to your liver. Your immunity is coming partly from your reticuloendothelial system and your liver. Now, the liver is actually the largest lymphatic organ. It's an organ that's involved with your immunity. And when it's very congested, it does predispose us to picking up all types of autoimmune conditions or developing autoimmune conditions because it's harboring waste that it's having a difficult time processing. Now, you might be wondering, okay, so my liver is a big deal. I'm hearing that my liver is a pretty big deal. Why would my liver not be in a good place? Like, what are some things that perhaps in my lifestyle I am doing that are contributing to liver irritation? One of them is definitely pharmaceutical use. Chronic pharmaceutical use can create liver stagnation. Excess carbohydrate intake, so carbohydrates that are low glycemic carbohydrates, sugary, sweet carbohydrates, those types of things are going to put a burden on the liver. So we actually can develop hypercholesterolemia, carb-induced hypercholesterolemia. So too much carb coming in can actually create the liver, could actually cause the liver to have irritation and start producing cholesterol. Okay, now I won't even get into this in this video, the whole age-old notion of, oh, I have high cholesterol, so I should stop eating egg yolks and meat. No, you should stop eating carbohydrates and sugar. That's really where it comes from. The liver spews cholesterol in response to high carbohydrate intake, not from cholesterol, from food. Okay, that's a little bit misdated science. That's very old science. I actually put people that have high triglycerides, high blood lipids on ketogenic diets, and works wonders for their lipids. Okay, there's a lot of factors that are involved with the cholesterol synthesis process, but just know that it's often carbohydrates that are causing excess cholesterol in the bloodstream, not cholesterol from egg yolks or fatty meats or bacon or all the things that we've been taught. That's dated science, okay? So with that being said, alcohol, toxin, drugs, toxins, mold, any type of stealth infection can create problems in the liver. Viruses can create problems with the liver, parasites, liver parasites, all of these things that we're kind of living with can also create problems with our liver and cause stagnation. So there's lots of reasons why. There's probably about 25 different reasons why someone's liver might not be working optimally. We don't always know why. We can certainly try to figure out the why and the cause behind it. However, regardless of the why, we have to make sure that we have good liver health for all of the things that are connected to feeling well, for body pain, for joint pain, for even headaches, for skin rashes, for periods, for menstruation, for hormones, both men and women. There are so many jobs that the liver does. Now it is the season of liver cleansing, and I do have a specific protocol I do with a lot of my patients. So certainly if you are someone that's like, I think I need a little help with my liver, I think I need to balance out some of the things, of course, connect with me or someone like myself that might be able to support you. But in most diligent functional doctors protocol, you will find that the liver is an organ that we prioritize as a big piece of your health, a big piece of your healing. So I hope this video was very helpful for you guys to learn a little bit about, wow, my liver is doing so much more than just filtering liquor. Okay, that's kind of the take home point. If you happen to like this video, be sure to give me a little thumbs up, and don't forget to subscribe to the channel, because that way you will get notified every time a new video comes out. I also do post some things on here about upcoming seminars, webinars, events, Zoom room events, or things even in the flesh that we might be doing. So don't forget to subscribe so that you can stay up to date with all of that stuff. I will see you guys in the next video, and thanks for tuning in.